67-year-old man goes snow machining with his son-in-law and bumps into a tree. For the 24 hours afterwards, he notices urine in his blood. It goes away, and the man doesn't give it another thought. A year later, he's wrestling with his dog, and the dog steps on his genital area. For the next 3 days, he notices blood in his urine again. This time, he decides to go to the doctor to check it out. The standard request for a urine sample is given, and the nurse starts the normal testing of the urine. The nurse sees blood clots in the cup and has the doctor take a look at it under the microscope. The doctor sees that there is tissue in the clot and feels that the man should see a urologist. The man sees the urologist the next day, and upon examination is told that he has bladder cancer. That abrupt announcement was delivered to my father this past spring. My whole family was devastated by this news. The next day my father underwent a transurethral resection and had a tumor that was growing over 30% of his bladder removed. From what the doctor could see, he had no symptoms to speak of, except for the 2 incidents of blood in his urine 1 year apart. Bladder cancer is growing in adults at an alarming rate. According to the National Cancer Institute, there were 73,510 new cases of bladder cancer reported in 2012, with 14,880 people resulting in death. Because my family and I are working through bladder cancer, and with my dad, I'd like to discuss the risk factors, symptoms, and treatment options of bladder cancer so that maybe with early detection, one of your loved ones won't receive the same devastating news. The risk factors of bladder cancer are smoking, increased age, Caucasian, male, chemical exposure, diabetes medication, chronic bladder infections, and other personal histories of cancer. My dad quit smoking when he was 58 years old, about 12 years ago. But he just developed bladder cancer. So even the doctor said, even if you are a previous smoker, you're still at risk for bladder cancer. Increased age, the older you get, the weaker our bladder lining gets, and the more susceptible we are to cancer cells growing there. Caucasian, most of the information and research that they have shows that it's more predominant in white males versus African American, Indian, Polynesian, Eskimo, any of those other categories. Chemical exposure, if you are exposed to certain chemicals in your profession, you're also more at risk for bladder cancer. Some diabetes medications can cause you to be more at risk for bladder cancer. So if you are a diabetic, you need to check with your doctor to make sure that that is not one of the possibilities from the medicine that you're taking. Symptoms of bladder cancer is blood clots in the urine. Hematuria occurs in 9 out of 10 people. Painful urination and frequent UTIs. With the frequent UTIs, men, it is almost impossible for them to get urinary tract infections because their urethra is much longer than in females. So it's harder for the bacteria to travel up and get into the tract or the bladder itself. But if you are a male and you get frequent urinary tract infections, you definitely need to be seeing a doctor to see what the problem, the cause of that is. Advanced symptoms of bladder cancer is pain in the low back, around your kidneys, swelling in the lower limbs, and a growth in the pelvis near the bladder area. Treatment options for bladder cancer there's 3 main ones. The first one is surgery. When bladder cancer is growing, it sometimes looks like a cauliflower. So the doctor will go in, insert a scope up through the urethra, and remove the tumor that way. That's called a transurethral resection. The other kind of it, for more advanced stages of bladder cancer, it's called an open surgery. Partially removing the bladder is called a partial cystectomy, and a removing of all the bladder is called a radical cystectomy. In a partial cystectomy, they just remove a portion of the bladder. With the side effects from that surgery, you may have a smaller bladder where you can't hold your urine as long, or you may have to empty it more frequently. With a radical cystectomy, the doctor will create a pouch out of the lining of your bowel, or you may have what they call an indwelling catheter, and the urine will flow into a bag. Radiation is also another form of treatment. There's external radiation and internal radiation. External radiation, whereas the radiation beam is centered right on the outside surface of the body of the bladder. Internal radiation is called brachytherapy, where they actually insert a catheter up through the urethra into the bladder and they deliver and administer the chemotherapy that way. The third kind of treatment is called regular chemotherapy. There's systemic chemotherapy, where you get an intravenous line in your arm and they give you the chemotherapy that will cover your whole body, or they do an intravesical chemotherapy, where another catheter is inserted through the urethra into the bladder and they deliver the chemotherapy into the bladder, and that's localized. Another form of therapy is called biological therapy. This type of therapy uses the body's immune system to fight the cancer. It's also called BCG solution, which contains a weakened bacteria that helps your body's own immune system break down and fight the cancer cells. Now that we've explored the risk factors, symptoms, and treatment options of bladder cancer, my simple request is just that you pay attention. Pay attention to yourselves, your family, your friends. If you or they notice blood in your urine and can't explain what happened, or you have several combinations of the risk factors or the symptoms that I have talked about, see a doctor. Hopefully there's nothing serious going on, and the only dreaded news is the amount of how much the office visit is going to cost. Thank you.